touched on some things about skincare and taking care of your skin, which ultimately we all want to take care of our skin. You know, we want to protect it. We want to make sure that we're using proper products for our skin. Usually men have a harder time wanting to use skincare products. Hopefully that's not the case with you gentlemen. I want to start with speaking about the peels. So peels are really important, especially at this time. This is a great time to start doing chemical peels, helping rejuvenate the skin, removing dead skin like Dr. Marwood was saying. That will help bring new cells to life and also help make the skin hydrated and give nourishment, and also make it look more supple, and give you an your skin tone will have a great complexion as well. So you'll have an even skin tone, you'll have a lot less sun damage, so those are really important. But also having great skincare at home is important as well. So using a great cleanser to cleanse the skin to keep it clean, and then a great moisturizer to help keep it hydrated and moisturized. And then you want to have a really good sunblock. Sunblock is very important, which, like you said, Dr. Marwood said, sun damage is, you know, what causes the skin to deplete of collagen, and it loses its volume, and it's, you know, it gets like a raisin, basically, you know. So SPF is super important in your regimen at home, especially when you start doing treatments like chemical peels, anything to the skin. We want to prep it. We want to make sure you're using good skincare products at home before you start doing chemical peels to rejuvenate the skin. Also wanted to touch, there's pamphlets in your guys' little bags. Everybody has pamphlets as well. And there's a great little pamphlet that has all the products that we carry, which are our most popular products. And we're also nominated in New Beauty for their, you know, best products, and as far as what we use here in the office is a professional product. Okay. I don't know if Dr. Marwood has anything else you'd want to
Or
say.
Lord, can you talk briefly about what it means to come in and have a facial with an esthetician?
Definitely. So when we have our patients come in to see our estheticians here for the med spa, you're definitely going to get a good consultation. They're going to talk about what your goal is for your skin, what you want to see differently about your skin, the type of products that you're also using at home, what we can do to help your regimen improve, and then also help you get to your skin goals.
So I think of good skincare almost like dental care. Mm-hmm. You know, you can see the dental hygienist and dentist couple 2-3 times a year, and you get into a routine at home of flossing and brushing and taking care of your teeth. And it's very similar to skincare. I think that everybody in California, especially those of us that love the outdoors, can benefit from good skincare, avoiding the sun, learning to properly moisturize and cleanse and help turn on that factory layer, the germinal matrix, to make more baby cells. So it's just very much like taking care of your teeth. You want to floss and brush at home, you want to get into a good skincare regimen, and then 2, 3, or 4 times a year see the esthetician.
Mm-hmm. Definitely. And that way we can keep your regimen going as far as the time when it changes for summer and for winter. As you know, as time changes with the weather, when it gets warmer, we won't use a thicker moisturizer. You can go lighter. So changing your products as the seasons change as well, and improving your skin and protecting it throughout that time is the goal.
Was it a peel that you were talking about?
The chemical peels. So there's we have 3 different ones, actually 4. We have the medical grade, which Dr. Marwood was talking about, the TCA peel, which is a very abrasive peel. It's, you know, you're going to have a lot of redness. You're going to have a lot of dead skin that'll be shedding. But in the end, you'll have new skin. Baby skin is what I like to call it, baby skin. So we have that peel, which is pretty aggressive. And then we have the other peels that we have with the esthetician that does the peels here. And that's the pamphlet here. So Skin Medica is what we do. We have 3 different peels, and each one is a little bit stronger than the other, depending on how abrasive you want to be with your treatment and what you discuss with the esthetician in the room during your consultation and with your skin goals.
Okay.
Okay.
And how long does it take before your skin is rejuvenated and you can go out?
Well, you can go out. With these, they're not as aggressive as the TCA peel. You can go about your day and go to the grocery store. You'll be a little red. I definitely suggest, keeping your skin protected, even if it's raining or it's cloudy. You definitely want to just keep the sun exposure down throughout your treatments. Always recommended to do at least 3 chemical peels. So we ask that you do a series of 3 to do the peels, so that way each series you're able to get to the dermis a little bit more, remove dead skin, and continue your process for your goals for your skincare. Okay?
Thank you.
You're welcome. Any other questions? No?
When do we
Thank
talk
you,
about
Laura.
prices?
About prices?
Mhm.
We'll actually discuss that once you're able to come in for a consultation, and we discuss all those things whenever you're ready to actually go through with your services.
And what about your product line? Are you selling moisturizer without consultation, or?
I definitely recommend getting a consultation first with the esthetician before you buy any products. That way we can discuss what you already have at home and then discuss what you may need for further treatment.